I'm Chen Chen. I'm coming from Brisbane, University of Queensland. I'm the professor of endocrinology in the university. I come to here today is to talk about the growth hormone regulation. It's mainly the interaction between growth hormone and obesity. And what the key point I try to convince the audience today is to say that growth hormone replacement, we got to be very careful and not to use growth hormone too widely, because growth hormone change may reflect a physiological change in response to the obesity or overfeeding. Thank you.
Hi, I'm Peter Callan. I'm a plastic surgeon from Australia who's done a workshop here at Aesthetics Asia. What we did was a workshop with the emphasis on anatomy and safety in injectables. So that's with neuromodulators, botulinum toxin mainly, and hyaluronic acid fillers. The main emphasis of the workshop was learning the anatomy, learning the functional anatomy, learning all the anatomy regarding planes, blood vessels, nerves, muscles, knowing where to put fillers, knowing where to put neuromodulators, knowing exactly how to be safe when injecting them, how to avoid problems, and if you do get into problems, how to get out of them. So that's the main focus, and we had touched a little bit on aesthetics as well, but aesthetics is something for another day. Our main focus today was anatomy and safety. But Caucasian and Asian basic anatomy is very similar, it's just shapes are different. So for instance, with Asians don't like having their cheeks highlighted too much if they're wide already because of the width. They don't like the width. So we have to alter where the filler goes. That's a very important thing to know. I often want filler in the submalar area in order to round the face off, rather than the Caucasian who wants to highlight the cheeks to make the face more triangular. So in actual fact, while everything is similar, there are certain differences that you have to take note of when we're doing it.
Would you like to highlight one of the common mistakes people make, and one of the thing that you always advise doctors how to get out of, like you mentioned just now? Would you like to touch on just one problem?
Well, I can touch on the most common problem with fillers is probably not a safety issue. The most common problem with fillers is not a safety issue. It's probably more of an aesthetics issue. In other words, making people at the end of the procedure look normal and look harmonized. That's what we want. And one of the commonest mistakes is overfilling or filling the wrong places. In other words, filling every deficit or knocking out every movement. These are not what we want. It's the combination of the positive and the negative that leads to beauty.
Some pigmentary disorder as one of the supplement. Although glutathione is used to lighten the skin in indirect manner, because we consider glutathione as an antioxidant.
Grace Lopez from the Philippines. I'm a dermatologist in practice. So I'm here now to talk about melasma. It's about the topical updates for the treatment of melasma. Actually, this is a very interesting topic, which most of most of our audience usually really very interested in this topic, because there's a lot of condition of melasma nowadays, especially for Asian women. Not only for Asian women, but also for men also. It's more common conditions among Asian skin individuals.
Hi, good morning. I'm Dr. Ko. I run the dermatology practice at KK Women's and Children's Hospital. We run both the children's dermatology clinic as well as the women's dermatology clinic. I just chaired the session on pigmentation at Aesthetics Asia, and we talked a lot about melasma, both the pathogenesis or the cause of melasma as well as the treatment of melasma. And melasma is a very, very common problem that we see in the clinic in both women and men. Of course, it affects women more often, and it's very, very difficult to treat. We use creams, we use lights, we use lasers, but it comes back after treatment stops, and it's a very, very distressing problem in many patients. We feel that hormones play a major role in the development of melasma. So female hormones especially can induce melasma. And we see that in patients who are taking oral contraceptive pills. We see it in women who are undergoing menopause. So this reaction to female hormones is known to worsen or trigger melasma.
My name is Caroline Lowe and I'm a general practice. The talk that I did today is an update on testosterone, and what we actually want to tell the people, especially in Asia, is what is usable, what is not usable, and what are the stop checks that we are supposed to be following according to the Urological Society. Aesthetic Asia conference is divided into 3 arms. There's the plastic surgery arm and there's the dermatological arm. My arm is the anti-aging arm, which is actually internal medicine. It's internal aging, and the lectures that actually been brought over from abroad are all talking about physiological hormones testing. We're talking about physiological hormones level, hormonal imbalance, quality of life. We're not going to definitely increase the levels to a supraphysiological level to look like, say, someone like Sylvester Stallone. You know, it's at the end of the day, it's balancing our internal to have healthy lifespan. And that's what anti-aging is all about. A bit yellow.
So, the main indications for our treatment are the skin rejuvenation, which leads to the collagen regrowth. So the intensive ultrasonic waves leads to 3 therapeutical effects.
What I'm going to talk about at the last session is hopefully to bring all the other people's marvellous information together so that it all begins to make sense.
Very practical, it's and very clinical, because I appreciate that there's some people in the audience who may not be doctors, but probably coming from the cosmetic side.
I'm Dr. Peter Tunbridge. I'm an expert in estrogen metabolism. I work in Adelaide in South Australia, and my main clinical load is women aged between 35 and 65 years of age. I've been able to put forward some new concepts in the treatment of pre-diabetes. So I've been able to show that in fact it's not pre-diabetes but early diabetes that comes on after a meal, and the body is able to repair itself, and as such everything is fine until the person eats again, but that gap between when the body heals and the time they eat again gets less and less and less and less until the body can't heal, which is then when it's called diabetes. So we should be treating it long before it gets to that stage.
I'm Dr. Nathan Francis from Australia, giving a talk today on designer diets for healthy aging, with emphasis on reduction of inflammation to the body and also consequently to the skin. Allergic foods can cause inflammation to the gut, and that can move from the gut to affect the skin and the brain. So the clues that this person is allergic to foods is if they get bloating, wind, indigestion, constipation or diarrhea. And sometimes if they may get headaches or migraines when they eat certain foods, or they feel tired, or they have hay fever or sinus problems. They're all clues that there's a reaction in the gut to foods that's causing not only localized problems in the gut, but also in the brain and the skin. So the first thing is to try and cut out as much gluten as possible. And the second thing is to move away from dairy to rice milk or homemade almond milk. And to eat everything fresh and avoid preserved meats like sausages or the Chinese sausage or bacon or ham. So they are the simple measures one can do to have a low inflammatory diet. and that will help not only the gut but also general well-being.
Good morning, my name is Sabine Zenker. I'm a dermatologist practicing in Munich, Germany, and I'm feel very honored to be here in Aesthetics Asia. The purpose of being here and lecturing and teaching and doing workshops is to share knowledge in aesthetic dermatology based on patient needs and based on different technologies. We just did some lectures in a body contouring session and a keynote lecture on dermal or on filler injection guidelines and some principles to understand. And I think it's very important to have not only the knowledge of how to do a treatment, but to carefully look and hear to our patients and see their needs and see what we can actually give to them with our treatments.
Okay, so you can do very easily in the office-based cosmetic procedure, Botox, filler, ultraviolet, something like that. Wants to find something which has a less downtime and has a good effect. This is the almost all the patient needs, what they want. So we are following the nasolabial fold and going upward mid-face lifting. So we put usually every 1 centimeter, see, like this. So we're going upward this way, toward this way. Our ultra-V lift is first observable thread lifting in the market. So it is kind of safe and quite effective. So that's the reason why in a short period of time, it spread all over the Asia very quick, very fast.
Can you explain a little bit what the product is?
Okay. Our ultra-V lift stimulate your own collagen. So it's not kind of a mechanical lifting, but it stimulates your collagen and it makes you very firm and natural lifting without any downtime or without any severe problem later on.